Okay, so I'm gonna be doing something that nobody asked for ever. So recently, I just got back on the pill because my body hates itself. I didn't have my period for like 7 months. So there was a chance that I was like, am I pregnant? I don't think so. Then I found this really cool app called Nurex, non-spons. Nobody's ever gonna sponsor me, let's be real here. So I found a really cool app and I hate talking to people, and it's for people who hate talking to people. You can just order your birth control online and then it ships it to you, and I didn't have to talk to anyone, and it was great. But turns out they didn't have anything for my area, for my prescription, so I was like, cool, awesome. But they sent it to my Publix. So after getting it sent to my Publix, I was able to go pick it up there. Did I still have to talk to someone? Yes, but granted it was only one person and she was really, really sweet. So shout out to Stephanie at the Publix pharmacy. Now, originally, literally no one cares about this. I would take the Cariva birth control. I don't know the difference between birth controls. All I know is that when I went to the OBGYN for the first time when I was a child, they told me to take Cariva. I know there's like 500 different birth controls, but I was saddled with Cariva. So I took Cariva for like 3 years. Once I moved, I just stopped taking birth control because I was working. I didn't have time and I kept on forgetting to take it. And then eventually I was like 3 weeks behind and I'm like, there's no way I can fix this. And then my refill thing just expired. So I couldn't go back to Publix and just pick it up again. At this point, I had to go to an OBGYN and they were gonna look at my pussy. And I was like, you ain't looking at my pussy because I don't know you like that. I went over a year without birth control, maybe even on 2 years. I just was living my life, you know, nobody likes me, so it's not like I was fucking anyone. Then I met a guy, same cuddle guy. I know, I stayed with that one, but that's for another video. There was a point in time where I was like, fuck, I might be pregnant, because I'm a dumb bitch that can't say no. I don't know how to say no to anybody. I was like, oh shit, there, you know, might be a chance that I'm pregnant. I bought a pregnancy test, which is really weird to do when you're 19 and a Target by yourself. It's the wildest thing in the world. That's an issue in itself. Luckily, I was not pregnant. To my mom, I was like, hey, mom, I might be pregnant. And she got mad. And then she was like, if you're gonna be fucking some boys, you're gonna be on some birth control. So I was like, cool, whatever. I got back on my birth control, but it wasn't Cariva. For some reason, Nurex, like, it was weird. So they gave me a new one called Mylan. And I'd never taken Mylan before. I kid you not, that shit made me sick. That shit made me depressed. That's up for grabs because we've always been depressed here. I noticed that whenever I got my birth control, it came with instructions. And I just thought you just take it at night, every night, and you're good. But no, there's a lot of instructions. I mean, this is a little ridiculous. These are all the instructions. And it's not like one side is in English and one side is in Spanish. No, this is all in English. It's wild. I decided today I should probably read the instructions on my birth control. I've been taking it for a good long time, going on 4, maybe 5 years. I never knew there were instructions. Let's all take a gander with me. I literally don't even know where to start. I don't know what like step 1 is. There's a lot here. There's also some fun stickers. I'm not really sure why it's the days of the week. I guess it's like if you don't want to start on Sunday, but that's whatever. So I think this is the beginning. And it's this thin ass, easily ripping paper. So we all know I'm a fucking mess. So let's try not to rip this. God damn. Here we go. Mylan instructions. This product, like all oral contraceptives, is intended to prevent pregnancy. It does not protect against HIV infections, AIDS, and other sexually transmitted diseases. So that was in bold. I want to make sure we're on the same page. Oral contraceptives, also known as birth control pills or the pill, are taken to prevent pregnancy, and when taken correctly, have a failure rate of about 1% per year when used without missing any pills. That's still a lot. 1%? No. The typical failure rate of large number of pill users is less than 5% per year when women who miss pills are included. So that would be me, because I can never take this on time. For most women, oral contraceptives are also free of serious or unpleasant side effects. However, forgetting to take the pill considerably increases the chances of pregnancy. Pray for me, y'all. For the majority of women, oral contraceptives can be taken safely, but there are some women who are at high risk of developing certain serious diseases that can be life-threatening or may cause temporary or permanent disability. The risks associated with taking oral contraceptives increase significantly if you smoke, have high blood pressure, diabetes, or high cholesterol, have or have had clotting disorders, heart attack, stroke, angina pectoris, cancer of the breast or sex organs, jaundice, or malignant or benign liver tumors. 10.4. Although cardiovascular diseases may be increased with oral contraceptive use after age 40 in healthy, non-smoking women, even with the newer low-dose formulations, there are also greater potential health risks associated with pregnancy in older women. You should not take the pill if you suspect you are pregnant or have unexplained vaginal bleeding. Okay, but that's so dumb. Like, women's vaginas are literally an enigma. It's wild. Things happen and it's just like, that's normal, but nobody ever tells you that. That's the tea. Cigarette smoking increases the risk of serious cardiovascular side effects from oral contraceptive use. The risk increases with age and heavy smoking, 15 or more cigarettes per day, and is quite marked in women over 35 years of age. Women who use oral contraceptives are strongly advised not to smoke. Most side effects of the pill are not serious. The most common What the hell? The most common such effects are... Is that like grammatically correct? I mean, I'm a dumbass, so like I could be wrong, but I don't think that's right. Mylan, I'm gonna need your editor to get on it. The most common such effects are nausea, vomiting, bleeding between menstrual periods, weight gain. We all know I'm just gonna gain some weight because I'm a fat ass who wants to eat Chipotle every day. Breast tenderness, headache, and difficulty wearing contact lenses. These side effects, especially nausea and vomiting, may subside within the first 3 months of use. The serious side effects of the pill occur very infrequently, especially if you are in good health and are young. However, you should know that the following medical conditions have been associated with or made worse by the pill. Oh my god, this is way too much, y'all. Blood clots in the legs or lungs, stoppage or rupture of a blood vessel in the brain, so stroke, blockage of blood vessels in the heart or other organs of the body. As mentioned above, smoking increases the risk of heart attacks and strokes and subsequent serious medical consequences. I didn't understand a word in that sentence, so we're gonna continue on. Liver tumors, which may rupture and cause severe bleeding. A possible, but not definite, association has been found with the pill and liver cancer. However, liver cancers are extremely rare. The chance of developing a liver cancer from using the pill is thus even rarer. Thank you. High blood pressure, although blood pressure usually returns to normal when the pill is stopped. Either get the dick or have high blood pressure. The symptoms associated with these serious side effects are discussed in the detailed leaflet given to you with your supply of pills. I didn't get a leaflet. Notify your doctor or healthcare provider if you notice any unusual physical disturbances of your supply of pills. Notify your doctor or healthcare provider if you notice any unusual physical disturbances while taking the pill. In addition, drugs such as rifampin, as well as some anticonvulsants, and some antibiotics may decrease oral contraceptive effectiveness. Yikes. There is a conflict among studies regarding breast cancer and oral contraceptives use. Some studies have reported an increase in the risk of developing breast cancer, particularly at a young age. This increased risk appears to be related to duration of use. The majority of studies have found no overall increase in the risk of developing breast cancer. Some studies have found an increase in the incidence of cancer of the cervix in women who use oral contraceptives. However, this finding may be related to factors other than the use of oral contraceptives. There is insufficient evidence to rule out the possibility that pills may cause such cancers. I'm gonna get cancer apparently. Taking the pill provides some important non-contraceptive benefits. These include less painful menstruation, less menstrual blood loss and anemia, fewer pelvic infections, and fewer cancers of the ovary and the lining of the uterus. So it just told me that I could get cancer from taking this pill, but it also just said that this pill is gonna benefit me by not getting cancer. Okay. Be sure to discuss any medical condition you may have with your doctor or healthcare provider. Your doctor or healthcare provider will take a medical and family history before prescribing oral contraceptives and will examine you. The physical examination may be delayed to another time if you request it and your doctor or healthcare provider believes that it is a good medical practice to postpone it. You should be re-examined at least once a year while taking oral contraceptives. The detailed patient information leaflet, didn't get a leaflet, gives you further information which you should read and discuss with your doctor or healthcare provider. So I am fucked. This product, like all oral contraceptives, is intended to prevent pregnancy. It does not protect against transmission of HIV, AIDS, and other sexually transmitted diseases such as chlamydia, genital herpes, genital warts, gonorrhea, hepatitis B, and syphilis. Okay, so now we're actually at the instructions. Instructions to patients. How to take the pill. Important points to remember before you start taking your pills. Number 1, be sure to read these directions. Oops. Before you start taking your pills, anytime you are not sure what to do, the right way to take the pills is to take one pill every day at the same time. If you miss pills, you could get pregnant. This includes starting the pack late. The more pills you miss, the more likely you are to get pregnant. Not gonna lie, I was doing really great on like taking my pills every single night. Not at the same time though, because nobody has time for that. But last night was the first night that I missed a pill, so I guess I'm getting pregnant. Many women have spotting or light bleeding or may feel sick to their stomach during the first 2-3 packs of pills. Me? If you feel sick to your stomach, do not stop taking the pill. This problem will usually go away. If it doesn't go away, check with your doctor or healthcare provider. Missing pills can also cause spotting or light bleeding even when you make up these missed pills. On the days you take 2 pills to make up for missed pills, you could also feel a little sick to your stomach. That is 100% true. If you miss a pill, my mom always told me to take the pill that you missed in the morning, and then take your other pill that night, so that way it kind of balances out. I did that once and I was so sick. I was nauseous. I was vomiting everywhere, but it was fine because I wasn't gonna get pregnant, even though I wasn't fucking anybody at that time. If you have vomiting or diarrhea for any reason, or if you take some medicines, including some antibiotics, your pills may not work as well. So don't get sick if you're taking the pill, because then, you'll get pregnant. Use a backup method, such as condoms, foam, or sponge, until you check with your doctor or healthcare provider. Does anybody know what foam or sponge is? Like, I know what a condom is, but I don't know why it said such as condoms, foam, or sponge. I don't know what foam or sponge is. Okay, sure. If you have, this is me everyone. If you have trouble remembering to take the pill, talk to your doctor or healthcare provider about how to make pill taking easier, or about using another method of birth control. If you have any questions or are unsure about the information on this leaflet, call your doctor or healthcare provider. Cool, 10-4. Before you start taking your pill, decide what time of day you want to take your pill. It is important to take it at about the same time every day. And I hope that when they say about, they mean that like if one night I take it at 10 p.m. and then another night I take it at 5 a.m., like that's okay. I'm not sure, but whatever. I'm not pregnant yet. Look at your pill pack. It will have 28 pills. This 28 pill pack has 26 active pills with 2 inactive pills. Also find where on the pack to start taking the pills, in what order to take the pills, and the week numbers as shown in the picture below. And there's a fun little diagram of what your pill pack looks like, but no one cares about that. Be sure you have ready at all times another kind of birth control, such as condoms, foam, or sponge. Again, I don't know what those are. Apparently it's another form of birth control. Am I just gonna shove a sponge up my pussy? Is that what that is? I don't know. To use as a backup in case you miss your pills. An extra full pill pack. When to start the first pack of pill. You have a choice of which day to start taking your first pack of pills. Decide with your doctor or healthcare provider which is the best day for you. Pick a time of day, which will be easy to remember. Day 1, start. Pick the day label strip that starts with the first day of your period. This is the day that you start bleeding or spotting, even if it is almost midnight when the bleeding begins. Place this label strip in the cycled tablet blister over the area that has the day of the week, starting with Sunday pre-printed. So those are the little stickers that they gave me. Note, if the first day of your period is a Sunday, you can skip steps 1 and 2. Take the first active white pill of the first pack during the 24 hours of your period. You will not need to use a backup method of birth control since you are starting the pill at the beginning of your period. Sunday start. Take the first active pill of the first pack on the Sunday after your period starts, even if you are still bleeding. If your period begins on Sunday, start the pack that same day. Use another method of birth control as a backup method. If you have sex anytime from the Sunday you start until your first pack. Use another method of birth control as a backup method if you have sex anytime from the Sunday you start your first pack until the next Sunday. Condoms, foam, or the sponge, again, I don't know, are good backup methods of your birth control. What to do during the month. Take 1 pill at the same time every day until the pack is empty. Do not skip pills, even if you are spotting or bleeding between monthly periods or feel sick to your stomach, nausea, in case you didn't know what that means. Do not skip pills even if you don't have sex very often. When you finish a pack or switch your brand of pills, wait 7 days until the next pack. You will probably have your period during that week. Be sure that no more than 7 days pass between 21-day packs. What to do if you miss pills. If you miss 1 active white pill, take it as soon as you remember. Take the next pill of your regular time. This means if you take 2 pills in 1 day, you do not need to use a backup birth control method if you have sex. That's rude. If you miss 2 active white pills in a row of your pack, take 2 pills in the day, remember, and 2 pills the next day. Then take 1 pill a day until you finish the next pack. You may become pregnant if you have sex in the 7 days after you miss pills. You must use another form of birth control, such as condoms, foam, or, you guessed it, the sponge, as a backup method for those 7 days. Oh my god, this is so much. If you miss 3 or more active white pills during your first 3 weeks, throw out the rest of the pill pack and start a new pack that same day. So if you miss 3, you're fucked. If you're a Sunday starter, me, a Sunday starter, keep taking 1 pill every day until Sunday. On Sunday, throw out the rest of the pack and start a new pack of pills that same day. You may not have your period this month, but this is expected. However, if you miss your period 2 months in a row, call your doctor or healthcare provider because you might be pregnant. You may become pregnant as you have sex 7 days after you miss pills. You must use another birth control method such as condom foams or the sponge as a backup method for those 7 days. Finally, if you're still not sure what to do about the pills you've missed, use a backup method anytime you have sex. Keep taking 1 active white pill each day until you reach your healthcare provider. Detailed patient packet insert. Oh my god, these are like big words that I don't understand. I think it's like ingredients, so we're gonna skip that. Please note, this labeling is revised from time to time as important new medical information becomes available. Therefore, please review the labeling carefully. So basically you're telling me that all of this could literally have changed already. Nice. Anywho, not gonna lie, that was literally 1/4 of all of my instructions. That is insane. I'm not gonna finish reading that because I'm already tired, I'm already bored, I have a headache. Apparently I'm gonna get cancer, but also I'm not gonna get cancer, but I'm also gonna vomit, and I'm also gonna become pregnant apparently. I don't know, it's way too much. So any doctor watching this right now, or anyone that cares, I'm going to need you guys to start yelling at people who make birth control and tell them to not make my goddamn instructions 500 pages long. Nobody's reading it. I'm probably the first person in the world to read this. Anywho, I've already missed a day, so apparently I'm gonna become pregnant, so let's check back in 9 months and we'll see if I'm actually pregnant.